Hi, I'm Allegra and I'm a second year medical student at UCL.
Hi there, my name is Dylan Hirani. I'm an intercalating medical student and I've completed 3 years of medical school at Barts and the London School of Medicine.
Hi, my name's Abdul Rahman. I'm a fifth year medical student at UCL.
Hi there guys, my name is Tafsir and I'm a final year medical student at UCL.
The medical course structure and to an extent the content can differ quite a lot between universities. However, the GMC sets standards so that every medical student is equally prepared when they leave university.
Medical courses tend to be between 5 to 6 years depending on whether you take an intercalating year, which is usually just 1 year out of medicine to do something a bit different.
My med school at UCL, we're quite traditional in the fact that we do 2 years of preclinical medicine where we learn all about the sciences of the human body, all the nitty gritty, so the biochemistry, the anatomy, looking at cadavers and dissecting bodies. We look at the physiology behind the human body processes, and basically cover everything on that micro, more cellular level.
And then we spend the last 3 years in clinics where we kind of shadow doctors. We work as part of a medical team, and we get to do a lot more on-hand stuff in applied medicine. That's not the case in other medical schools. In other medical schools, there's more integration. So, for example, at UCL, we don't see many patients in the first 3 years, but in other universities, you might be visiting a GP once a week from the first year of medical school.
I think it's super important to stay open-minded and allow yourself to experience the different aspects of medicine, gaining the various skills you need that will be applicable in both a medical and non-medical career.
Once you graduate, you start foundation years, which are effectively 2 years working in a hospital as a junior doctor in different rotations and different specialties, so you can get a feel around what specialties you like and which specialties you don't like.
The career opportunities are immense, like they are literally endless. So I think a lot of what people fail to realize when applying for med school, or even when in med school, is that this degree is really valid amongst all workplaces, because we do a lot of critical thinking, we have transferable skills, our communication skills are great, and therefore you can apply that to basically any sector of work that you choose to.
These careers could include anything from being a doctor, a physician, or a surgeon, which is what you typically expect from someone who does a medical degree, or it could be something completely different, like research, medical journalism, medical legal law, or even finance.
More than 50% of med students actually become GPs, so working within the primary healthcare system with the communities and local area people in the local area. Or we can work in psychiatry and work in psychiatric inpatient hospitals, or do other things with that. Now, the best part to this is that there's actually loads of things that you can do on a macro level on top. So, for example, public health medicine is a way to kind of make an impact, but on a larger level. And something that I'm quite interested in is global health, and that has allowed me to look at fields to do with humanitarian medicine, whether that be missions abroad, or whether that be working with charities and NGOs in stakeholder countries to try and make big impact changes.
Actually, there are a lot of opportunities that are around the medical field, so that can range from academia. So you could be really interested in kind of research and want to do a lot of research and go into that, and not maybe much practical clinical work. If you're interested in tech, you can work as part of a medical technology company, a medtech startup, which is something that I'm personally very interested in. A lot of medical students are nowadays. So there's a lot of different sorts of things that you could do, and I don't think there's one path.
The average day for a medical student can vary depending on whether they are a preclinical or a clinical medical student.
As a preclinical student, an average day is more about waking up. You would go into university to attend lectures, or these days you would attend them online. And to be honest with you, it's a lot of lectures, and it's usually very dense lectures. So it's a lot of bookwork. It's a lot of revising straight away from the lectures. Sometimes you would even read up on notes before the lecture if you knew it was a big topic. Things like anatomy would often be things that we'd read up on beforehand because it's very complex.
Whereas the day for a clinical medical student, so that's between years 3 and 5 usually, their day is usually at the hospital at placement. So in the morning, they'll attend a ward round and shadow the doctors and learn off them during the ward round. After the ward round, they may then help some of the doctors with the jobs they have. So whether that's taking bloods off patients or writing a couple of discharge summaries. And then in the afternoon, they may attend clinic and learn from the doctors during the clinic, or they may have teaching at the hospital where they discuss the cases that they've seen.
Average day for myself, a final year medical student, comprises of going into the hospital early in the morning, and so that's getting ward round notes ready for the ward round, going around with the consultant, the registrar, and the foundation year doctor that I will hopefully be in the next year. And then from that I scribe notes, I see patients with the doctor, I am involved in patient conversations about what's going on, why we're doing it, and that's my learning opportunity to find out. Let's say we've got a diagnosis, how do we manage that and how do we care for this patient? I get to examine the patient, I get to ask them questions about how they're feeling, their symptoms right now or before, and that's all kind of the clinical component that helps make you a really good doctor. Then after lunch we could have some teaching from the ward doctor, or we could split up into little groups that we have on our firms, and we can practice for our OSCE examinations, our practical examinations. And in the afternoons, after all of that, I come home, I chill, and in the evenings I'd either start catching up on the work that we need to do to revise for the exams coming up as the finals, kind of stay on top of the large quantities of workload and content. And I'd like to kind of like catch up with my friends. I'd like to either get myself active and do something so I'm not sitting at my desk the whole evening. And that's kind of all that work-life balance that you have to get involved from early on, because medicine is quite I think a difficult work-life balance career.
The medical application is essentially several hoops that you have to jump through. The misconception is that you've got to be someone who is exceptional in all of them, or just generally an exceptionally high ranking student. But actually, that's not the case. You generally just have to make sure that you can jump through each hoop. So it's really kind of making sure that you are consistent in every department.
We can roughly split the medical school application process into 5. Step 1 would be the pre-application prep. So this consists of doing the right GCSE, getting the right GCSE grades in order to do the correct A-levels, as well as undertaking any work experience that you can find in the field of medicine. Step 2 would be doing the personal statement. So the personal statement, effectively you need to demonstrate why you want to do medicine and back it up with any experiences that you have. Part 3 would be the admissions test. So this is either the UCAT or the BMAT, depending on which medical school you apply to. Step 4, once you sent off your application, the medical school will either decide to give you an interview or not. And lastly, once you've completed the application, you've done the interview, the medical school will then decide whether they would like to give you an offer or not. And you finally have to then achieve the grades that they offer, which are usually AAA and above. Occasionally you may get the contextual offer, which is slightly lowered, which is to help disadvantaged students in order to increase widening participation in medicine.
Loads of universities look at the work experience parts for your application to help get you an interview, and then when you're at interview you can then reflect on what you've done on your work experiences, what you've been reading, what you've been listening to about medicine, and what that's helped you kind of become inquisitive about this career and made you want to become that doctor.
There are different types of interview styles. There's the panel interview, and there's the multiple mini interviews, which is like sort of speed dating, where you go around 5 minutes per station. And most universities do the MMI model, and these are different ways of kind of they're all trying to figure out the same thing. They're trying to figure out, are you the right person? Are you on a personal level the right person for medicine?